Hello, and welcome back to Diagnosing Life, no copay required. My name is Aryana, and I am your host. And in today's episode, I'm taking you inside the OR. So let's talk about my mornings. And spoiler alert, it is a pretty early start. Typically in the OR, we start at 6 a.m. That's usually when our first case is. And so that means that I have to wake up at least between 4 and 4:15 in the morning. Depending on which hospital we go to, my drive is anywhere between 25 to 45 minutes. And so I make sure to wake up early in the morning and make my coffee because coffee is life, especially when you are starting so early in the morning. My alarm typically goes off around 4:10, 4:15. I do use a hatch alarm clock. And so around 3:30-ish, it starts having the sunrise come up. And then at 4:10, I believe I have the charms or some noise, bird noises. I'm not really sure what goes off, to be quite honest. I change it frequently. And anyway, around 4:10, the alarm goes off. I wake up, I drink my medications, and I go to the restroom, brush my teeth, wash my face, and I make sure to put my moisturizer and my under eye cream. That is a must every single morning. As soon as that is done, I go downstairs, I prepare my espresso. I try to make at least 2 shots of espresso, and then I kind of am letting my moisturizers sit for a minute during that time. I then go and pick out my scrubs that day. So on surgery days, I typically like to wear colorful scrubs. And so I will go ahead and pick out a bright color, except on Wednesdays. On Wednesdays, I always wear pink. So pink scrub cap, pink scrubs, the whole thing. But on Tuesdays and Fridays, I try to have a different color of scrubs, only because during clinic days, I only wear black and gray. And so it's a fun little mixture of color during the week. So anyway, I go ahead and put on my scrubs. Once that's done, I go ahead and apply some makeup. As far as my makeup goes, I typically just use sunscreen, which is going to be tinted sunscreen. And then I go ahead and put some mascara, typically put some concealer on. Right now I'm using the NARS Pot Concealer. I love it. It definitely hides all of my dark circles, and I put on some blush just so I won't look as dead and as pale. And that is pretty much my morning getting ready routine. Once all that is done, I go downstairs, I put some protein into my espresso shots, shake it up a bit, and get ready to go. Usually I try to pack my lunch the night before, and my lunch is very simple. I have a snack box, and so I'll put some carrots in there, some cucumbers. I put some ranch, hummus sometimes. I try to put as many snack bites as I can because we usually don't have a lot of time to eat in between surgeries. I also will go ahead and put some cheese and beef jerky, anything that has some type of protein, I try to put into my snack box. I've also tried to make sandwiches so I can have in my box, and that usually helps me hold myself up throughout the entire day, depending on how many surgeries we have that day. Another thing that is important is that I have my water bottle. Hold on. This right now is my favorite water bottle. This is my Hydro Jug water bottle. This is a sports edition. I have so many Hydro Jugs. I absolutely love them. And I will go ahead and fill up this bad boy with ice cold water. I also go ahead and put some liquid IV or some Propel, any type of electrolytes, because that really helps me keep going throughout the day. Okay, so that's pretty much my morning routine, getting into the car kind of thing. Once I get into the car, the first thing I do is call my mommy. I speak to my mom every single morning, and usually she's up by that time, either going to work out or she's just up waiting for my phone call. So I call her, tell her good morning, see how she's doing. And then I turn on some music. Usually I put Taylor Swift. I'm sorry. I love my Tay-Tay, especially in the morning. It just gets me in the mood. And I drive to the hospital. Once I get there, it's between 5:40 to 5:45. And I make sure the first thing I do is I go see my patient. I talk to them and I make sure that they already got their post medications. I try to send them either a day before or 2 days before. So I just make sure that they have already received the medications. If we did not send the medications because they have a pain management doctor, I also make sure that they already received those medications. If they don't, then I go ahead and make a note of it, so I can either call their pain management doctor or I go ahead and send the medications myself. I also go ahead and talk to the patient about wound care, post-op instructions, and I will also show them how to use a brace if they need a back brace. The back brace is really simple. A lot of patients have never worn a back brace, so I just kind of explain all those instructions to them and answer any and all questions that they may have. One thing I also have started to do is I review the imaging before the surgery or before the case with my supervising physician. We don't do this for every case because usually we've seen the patients right before their surgery and we've already reviewed them for it with them. However, if it's a case that is going to be complicated or it's a patient that we hadn't seen in over a month, we go ahead and review the imaging for that patient. Since I'm still a new PA, I go ahead and I have a little notebook of pretty much all the notes that I need for every single case, and I'll go ahead and review those notes really quickly before we go into the case. Now, my surgery days are a little different than other surgical PAs, and simply because I am in a private practice and we go to different hospitals all the time. I know other surgical PAs will go ahead and round on patients in the morning. I fortunately do not have to do that, only because we usually don't have our patients stay overnight. And if we do, I would round on them. Usually it's on Fridays and on Saturdays, but never usually on Tuesdays or Wednesdays when we have the patients. Most of our patients have already left the hospital by the time we go in for our second case. There has been a couple of times that we have had a patient stay in the hospital for over a week. And in that case, I will go check up on the patient in the morning after my first case or right before my first case, just depending on how early the case is. And I will go ahead and report to my supervising physician, just letting him know how the patient's doing, and that's it. So now it is around 6:05, 6:10. By this time, I have seen the patient, spoken to the patient, and I've had a couple of sips of coffee. Before I go into the OR room, I make sure to go ahead and grab my lead because all the cases that we do, we end up having to do x-rays to make sure that we are in the right spot, whether it be putting in cages or doing a simple decompression. We always have x-rays going in our cases. So I go ahead and grab my lead, make sure to put it in the room. The second thing I do is I go ahead and speak to my OR nurse, and I also speak to my scrub tech. We are very fortunate that we always have the same team with us whenever we're doing surgery, and I absolutely love them to death. And so I talk to them in the morning, make sure that if they need anything, I can go ahead and grab it. So I'll go ahead and do that, and then it's time to officially scrub in. All right, so after I have spoken to the OR nurse and my scrub tech, I go ahead and get any and all supplies that they need. I go ahead and put them in the room. I put my lead in the room, and I go ahead and scrub in. Now, this is my first scrub of the day, so I go ahead and do a wet scrub, and I make sure to get scrubbed really good, get all the nicks and crannies that I need to, and then I go ahead and dry off. Once that happens, I just kind of wait inside the OR room for the patient. It could take a couple of minutes depending on if anesthesia has already spoken to the patient or if they need to do another IV. Once the patient officially comes into the room, we go ahead and start positioning the patient. So anesthesia will go ahead and intubate the patient. Patient will be asleep. Then we go ahead and flip the patient depending on what surgery we're doing. If it's a back surgery or cervical surgery, we go ahead and flip the patient, position the patient. Positioning can take anywhere between 5 minutes to 30 minutes, depending on how the patient is. The factors is it could depend on size. Also, another thing is what level we're doing of the neck or the back. And so we have to make sure that we're going to have a good view for this, and so positioning can sometimes take a while. Once we position the patient, I go ahead and we start prepping the patient. I go ahead and clean the area with 4x4s and alcohol. After that, I go ahead and put my lead on, and I go ahead and do my dry scrub, which will be with the Avogar. Once I put the Avogar on, I am officially ready to be scrubbed in. By that time, the scrub tech's already scrubbed in. And so I go, she gives me my glove and gown, and we start prepping the patient. Okay, so now we are officially gowned and gloved, and now it's go time. I will go ahead and assist the surgeon anywhere between incision and closing time. Depending on the case, I'm either retracting, suctioning, placing drains, and closing all incisions. It all depends also how much trust you and your supervising physician have with each other. We have had a partnership for, I believe, 5 months already. By the way, I can't believe I've been a PA for officially 5 months. But we are slowly learning how each other's teamwork. And so little by little, he's trusting me a little bit more and he's allowing me to do more things. But regardless, I am learning so much from him. And I have grown so much as a surgical PA from day one to now. Just seeing how much I have improved with my suturing skills and just everything in between has been amazing. So in the OR, everybody works as a team. Whether you are handing the instruments, you're assisting the surgeon, officially doing the surgery, you are the OR nurse that is running around trying to make sure that we have everything that we need, to the anesthesiologist. We also have a neuromonitoring team, which monitors all the nerves for the patient to make sure that we haven't gone to a place that we didn't need to. The x-ray tech, our surgical tech, our scrub tech, everybody works as a team and we're all there for each other. And in the OR room, you're constantly anticipating the next move before anyone speaks. It's really interesting, especially because the surgical tech has been with my supervising physician for years now. And so she already knows what he needs by the time that he's going to ask for it. And I've gotten to the point where I'm getting the hang of it too. And I'm also learning how to anticipate his next move. And that's really, really nice. But it's intense, especially when something goes wrong. You have to think on your feet and you have to be calm, because if you're not calm, then you're not going to be able to think as fast. And you always have to make sure that everyone's working as a team and it's a well-oiled machine. So it's a great time. So during surgery days, we usually have anywhere between 3 to 5 surgeries. Usually they're back to back. And so there's very little time to eat in between. However, it is still very important to eat and drink as much water as possible. So in between surgeries, I go ahead and grab a quick bite. Like I said, I have a whole bunch of snacks in my backpack. So I go ahead and grab a quick bite and I look for the next patient. Once I see the patient, I go ahead and do everything that I did in the morning all over again, talk to the patient, post-op instructions, make sure that they have a brace if they needed a brace, and I go ahead and get them ready into the OR. There has been a couple of times where we'll have consults in between patients, and so the surgeon or I will go ahead and take turns and go see a consult. During the consults, I just go see the patient, see what's going on. If they've had any imaging, I go ahead and see the imaging. If there's no imaging, we go ahead and order imaging just so we can see exactly what is going on. Once we're there, I go ahead and perform a physical exam on the patient just to see how their nerves are doing and I check for muscle strength and tone to see if they have any weakness in their upper or lower extremities. Once I do that, I go ahead and explain to them all of their options and I report back to my supervising physician. At that time, we'll go ahead and look at all the imaging together and we'll decide if the patient needs to have surgery or if we would like to do more conservative care for the patient. Once we have identified the issue, we go ahead and speak to the patient, let them know what their options are and help them make a decision that is best for the patient. And so that usually happens in between surgeries if needed or right after surgery. And so our surgeries are typically between an hour and a half to 3 hours, depending on what the surgery is, what the case is. But we have had some surgeries that have had some complications and They have run up to 5 hours, which was pretty intense. A couple of weeks ago, I actually went in at 6 a.m. and I didn't get out till 7:30 p.m., which had been one of the longest days that I had had as a surgical PA. And that was really intense. We had complication after complication. We didn't have a break in between because all of our cases were extremely complicated. And this was not something that we anticipated at all. We thought it was going to be an easy peasy lemon squeezy type of day. And we were supposed to get out around 2:30. And so when the 2:30 mark hit and we were barely in our second case, I knew we were going to be in for a long haul and it was going to be a little crazy. And so, yes, we ended up staying up to 7 p.m., a little past 7 p.m. Thankfully, all of our patients were fine, and the complications were just complications in surgery and didn't have any post-op effects, which was really, really good. But yes, we do have some days that our surgeries run long and we just have to go ahead and keep going. And that is why I always have snacks and a lot of water in my backpack. All right. And so surgeries are officially over. Usually, let's say it's an easy day. So I'm going home around 4 p.m. Once I get home, I am extremely tired. And so I will get home. Usually already have dinner made because my fiance is amazing and he will already have dinner made. By the time I get home, we go ahead and eat together. We talk about work, how it was. And then I play with my pup. Well, he's not a pup anymore. He's 8 years old, but he's always going to be my puppy. I play with my puppy and we kind of just chill for a while, to be honest. It's amazing to be able to get home and just chill and not have to think about a future exam that's coming up or to prep anything for the next day for school. Honestly, I think that has been my favorite thing about becoming a PA because obviously, yes, I still study when I get home sometimes. I go ahead and review for cases or I look at different diagnoses and try to sharpen my skills in this specialty, right? But I have the leisure of doing it whenever I want. If I want to study for an hour, I'll do it for an hour. If I want to study for 4 or 5 hours, I can do that too, but I'm not at a constant stress level. And so it has become my favorite part of the day, just coming home and relaxing and being able to just enjoy life. It's amazing. I highly recommend it. But yes, I go ahead, get home, have dinner, relax, and then we go for a walk with my puppy. Usually on surgery days, I don't usually work out because I'm extremely tired. So Tuesdays and Thursdays are usually my Tuesdays and Wednesdays, are usually my surgery heavy days. And so those days I typically don't work out. I just go ahead and go for a walk. Fridays, I do have surgeries or procedures in the morning, but I'll only have procedures until probably 12 since we don't usually work past 12 on Fridays. So I'll go ahead and work till 12. I'll also go ahead and see any consults or round on patients, and then I'll go home, relax for an hour or two, maybe take a nap, and then I'll go ahead and go to the gym on Fridays around 3 or 4 o'clock, depending on what time I want to go. It's really relaxing. But that's usually what I do after work on surgery days is just relax, go for a walk, and enjoy life. So being a surgical PA is both physically and mentally demanding, but it's also amazing. You have to love the hustle and love being a morning person, to be quite honest. I'm a morning person, I really am. And so waking up early in the morning, going to get all this work done, doing procedures, doing surgeries, and then getting home around 5:36 is honestly the best schedule in the entire world for me. And I truly, truly love it. Every day is different and every patient teaches you something different. If you're thinking of becoming a surgical PA, know this: you don't have to be perfect. You have to have passion, you have to show up, and you have to be curious. Keep your hands steady and your heart open, everyone. And that's it for today's episode of Diagnosing Life. If you've enjoyed a glimpse into my surgical world, leave a review, share it with a friend, and follow for more behind the scenes from the front lines of medicine and beyond. Until next time, keep diagnosing life one story at a time. Goodbye.